Hello there, everyone. Thank you so much for joining us today for just a small portion of your afternoon here. I'm Sam. I'll be moderating this presentation today. I will also be monitoring the chat. If you have any questions, there is an anonymous Q&A box on the screen. Feel free to enter and ask away. We encourage your questions. Today's speaker is Wesley Boudreau, and he is here to discuss the potential increase to healthcare plans and the cost of healthcare plans in the coming year. Before Wesley comes on, though, I'd like to just very quickly remind you of a couple things. First and foremost, please be reminded that we are not your company here. We are not affiliated nor endorsed by any specific company. We are a completely independent group of financial advisors, so please keep that in mind as you're listening along. Speaking of financial advice, one of the links I'll enter into the chat is going to be a link to our calendar. You can get on one of our advisors' calendars for 15 or 30 minutes of free time to speak to them about any concerns you may have or to get started or updated on your retirement planning. We encourage that. That is what we do. We would love to help you. Next, you can follow us on YouTube. You can like our LinkedIn page. We post a ton of content for people who are transitioning into retirement from many, many companies, and we really feel you get value out of it if you consider giving us a follow or booking that a free appointment. And with all of that out of the way, let's just jump right into it now with Wesley Boudreau.
All right, thank you very much for that introduction, Samantha. And like she said, today we're going to be digging into healthcare, also kind of how it plays into the entire retirement planning process and how you plan around some of those different costs you're going to see. We'll dig into different options, whether it be through Medicare, retirement benefits for your employer, the ACA, the Affordable Care Act, and the Healthcare Exchange, how you kind of navigate that market as well and what those things look like. Now, we have worked extensively with a lot of different Fortune 500 companies, so if you have more detailed questions about your specific retiree medical benefits, feel free to reach out and let us know. We'll be happy to dig into that. Even though we've worked extensively, we're not employed or endorsed by them, but definitely one of our advisors probably has worked with your plan and can dig into some details for you. So two of the top things that we see whenever we focus or work with individuals that are in that process of retirement is number one, do I have enough money? Have I saved enough? Am I doing well in order to actually retire so I don't outlive my money? I want to make sure I've got something to pass on to my beneficiaries. Maybe it'd be significant, or maybe you want to make sure you write your last check on your deathbed. But you don't want to run out of money before you pass away. So that's the biggest concern, and one of those items that feed into that concern is healthcare costs. We've obviously, I think everybody knows they're rising. They've been rising for the last decade plus or so, and will probably continue to rise going forward. So that's a big concern for everybody, and we want to figure out how do we tie that into our actual retirement planning process, and that can back into how do we structure portfolios, how do we allocate assets, what's our investment goal, and things of that nature, which we get into as we get deeper into conversations with you. So let's take a look at some of the different costs and how that's looking as far as the cost of insurance. This is actually taken from Axios. This is showing a chart that's a little bit skewed from the actual numbers. It's their chart though. But if you add up all the different medical costs, whether it be private insurance, Medicare, Medicaid, that's projected to be close to $8 trillion by 2032. Actually, I think it's $7.7 trillion a year spending. Right now, it's about, I think, 4 point something, so right around 4 trillion in 2025. So again, a doubling, if you would, roughly of that going forward. So just keep that in mind. And then as far as the actual cost, moving forward, we're going to talk about, open enrollment. We'll talk about the expected cost, how we're seeing them, increase in various states. Because keep in mind the Affordable Care Act, if you're using that, it's state exchanges, so it's based upon what state you live in or what state you may retire to if you're looking at making a change there as well. We'll talk about alternatives before age 65, and then just healthcare insurance in general. So as far as getting into the open enrollment tips, so we're kind of coming up on this time frame where a lot of different companies and Medicare are going to have open enrollment in the kind of fall season, if you would. Medicare, I believe, is I think October 15th through December 7th. A lot of companies, maybe late October, most of November, so kind of similar time frames. And it's important to remember that open enrollment's when you can make changes to your actual healthcare plans, either through Medicare or at work. But that's the only time, unless you have different changes. Maybe you're changing jobs, maybe you're moving, maybe you have a kid or something like that. There are some special circumstances where you can make changes outside of open enrollment. But for most of us, this is the time when we need to analyze what we have and what our choices are, And it's important to take a look at them, even if you've been content with what you've had. A lot of times companies will throw something new in there, or there may be a change in the cost, so it's good to look at those. So some different top 5 things we have to consider, and we'll get on a checklist in just a moment here as well. But compare your medical, dental, vision, all your different options you have there. Make sure there's no changes. Make sure they didn't maybe add a company that could have better benefits for you. Make sure there's been no change as far as your doctor being on network or out of network. I know we went through this before with the dentist, where we were told they were in network and had something done, and then all of a sudden we were told they were out of network. So it cost us a little bit more than we wanted to pay, but it is what it is. Also consider life and disability, making sure that you've got taking advantage of maybe the group life insurance or group disability. It's really important to understand that. If you have questions on do I have enough life insurance, give me a call. We can run through those with you. A lot of you might be surprised to realize maybe you don't have enough, especially if you're younger. I actually brought on a client here recently, earlier this year, that made really good money, made over $500,000 a year, had multiple properties, had a family, had mortgages, things like that, and lo and behold, all he had was about $100,000 group life insurance. So obviously underinsured if something were to happen to him. So just keep that in mind. If you have questions there's group policies usually through your company. We can also work with you on simple term options or other options outside of that as well that are going to be your life insurance that you can take with you if you make changes to a company. Take advantage of HSAs, health savings accounts. If your company does provide that, it's a way for you to actually reduce your cost out of pocket, because you can save on taxes in the short term, and also in the long term as you let that grow over time if you don't use all of it. And then make sure you evaluate how this ties into your retirement savings. It may be that maybe you're spending more on healthcare. You might want to reduce your 401k contributions. Obviously, we wouldn't suggest that if you can afford it. We'd probably look at making increases, or maybe looking at saving outside the 401k and different options there as well. So don't hesitate to call in and review that with us as well. And then learn about any extra coverages that you may have, different company subsidies. It may be something that maybe your healthcare has got a reimbursement for joining a club or something like that, for working out, or maybe there's different telemed things you weren't aware of before that have come on board here recently. So just go through those, and kind of a quick checklist. Again, kind of reiterating that is review your health insurance, your savings and spending accounts, so your HSA potentially, dental and vision plans. Again, they're all separate usually. That life insurance we talked about, disability insurance. God forbid something happens to you, there's going to be short-term and long-term disability. You may or may not have to opt into it or opt out of that, so be careful in reviewing that. Your retirement savings, obviously outside of this open enrollment, but it's an opportunity for you to review that and see where you are. And if we back into a full retirement review, whether or not you need to increase your retirement savings and where you should be putting that, and how do you take advantage of it tax favorably as well. And then your beneficiary selection. This is one a lot of people overlook, especially if you've gone through a divorce, or you've had your family's been extended by having a new kid or something like that. You want to make sure you review your beneficiaries on your 401k and on your life insurance, and make sure it meets the needs that you want at that point in time. And if you've done a trust recently, maybe you want to look at reviewing that, whether it makes sense to put name the trust as a beneficiary. But I do caveat, make sure it's something you've done a recent trust, so it has a look-through provision, and not some of the old trusts from 15 years ago. There may be some issues there. So any questions, just let us know. As far as what's going to cost me? Unfortunately, probably more than you think. Or at least on an average, at least for the average person. There's a study from Fidelity that they do every year, and the average person thinks it's a lot cheaper than what it is. The average person thinks that, hey, it's going to cost us $41,000 over our lifetime once we retire for medical costs, because Medicare's covering things and we're not paying for that much. But in reality, that study shows that that's about a $274,000 shortfall. If you look at a couple age 65, it actually cost them about $315,000 throughout their lifetime for medical expenses, when you factor in premiums and co-pays and potential issues and things of that nature. And there's a 5% increase over the last year, and it's, I think, year over year, it's always been kind of that 5, 6, 7% increase range. So that expectation is that when you budget for things, we run a financial plan, we're looking at inflationary pressure, obviously across the board, but a lot of times it's more heavily weighted on healthcare costs there as well. And it's good to kind of understand your specific situation. Another client we're looking at that, bless them, they're looking at helping out family with their healthcare costs. So we're running, a financial plan that shows their healthcare costs and also their additional support for healthcare over the next 20 years or so. And we can run different inflationary measures for that versus, maybe your typical inflationary numbers on the rest of the portfolio. As far as the price of things, just to give you some statistics or give you some reality on what's happening, prices are still going up. Obviously, they're trying to control prices here on prescription drugs and things of that nature. But even in 2025, about 983 companies or different products that already had their list price increase. So again, keep that in mind. It may not necessarily affect you because your insurance company could absorb that, or you may be getting it for free anyway. But again, they still have increased their list price on things, and that trend has always continued. But hopefully, we can right the ship here sometime soon. As far as the cost for alternatives as you transition into retirement, a lot of times, we've been told, hey, full retirement age is 65 to 67. For most of us now, it's 67 when you focus on Social Security. But a lot of us don't want to work till 67 or 65, and 65 is when Medicare kicks in. So you may find yourself retiring at 59 or 62 or 57, and you might say, well, Wesley, what do I do between now and age 65 when Medicare kicks in? So there may be different options you have. The first and easiest, hopefully, is if you've got a company that still has a retiree medical plan. That's a good option if they still have that. It's an even better option if it's a good one. We've seen a lot of companies reduce these, eliminate, or do away with them altogether over the years. So again, if you've got one, it's good to review that. Now, it's not going to be as cheap as what it is right now while you're working, because again, you're going from an employee to retiree, and so you're going to see an increase in cost, but it may not be as much as if you compare it to the healthcare exchange or buying on your own or something like that. It could be that you retire. Let's say you might retire at 62. You might have a younger spouse that's still working. Maybe you can go on his or her medical plan. That may be an option. You may continue COBRA for a while. It's going to be more expensive there. You may decide to get a new job. I've seen this a couple times where we've run all the planning. Everybody can retire and they're good. They can cover the healthcare costs and things like that. But 4 months in, they're bored. They need something to do, and it could be something as simple as going and working part-time at Home Depot enough to get the medical insurance, going to Starbucks or going to Walmart, or who knows, just something to occupy the time. But you could search for a company that's good enough to give you a decent healthcare package as well. So that could be an option. And then if you don't have any of those options, you're looking at the healthcare exchange, which again, that's the state-based plans. We'll get into some of those rising costs there as well. And because they are state-based plans, you're a little bit limited on your selections and choices depending upon where you live. It's not a simple plan that's across the board, being able to pick from 10, 15 different providers. In some cases, you may only have one choice within your state, so that's something to review as you transition to retirement as well. So as far as the Affordable Care Act, there's obviously some bad things, some good things from it and stuff, but one of the good things is it's guaranteed insurance in there. And it may not be as expensive as you think. If you go out there and look and say, okay, I just retired, let's say I'm making $150,000 a year right now, and I look at that, then it's going to be pretty expensive when you look at it. But it's not about what you made, it's about what you're making going forward. So if you're retiring, you're not going to be having as much income, theoretically, especially if you're married and you both are retired. If one of you is still working, it may be more expensive, but you're able to get subsidies there and you get a reduction. So it may be more economical than what you think. And there's different plans there. There's going to be the bronze, silver, gold, and platinum. And those are all based upon essentially what you pay for what you get. The higher tier, like the gold and platinum, is going to be more PPO. It's going to cost you more. You get more access to doctors and things of that nature. Whereas the others are going to be more like an HMO, where you have limited access to doctors. You have to stay in network, and there's a little bit more hoops to potentially jump through. And that open enrollment, like we said, kind of goes through in the fall. Again, but let's say if you retire in May, then that creates an open enrollment for you because you're having a job change, you're having a life event or something like that. Or if you move post-retirement, you can look at doing that outside of open enrollment as well. But again, it's really important to kind of understand these and compare this, because it may be cheaper than what you actually thought. But we run through these when we were focusing on retiring individuals. So a good segue, when I say we run through these, really the best way to kind of encapsulate all this is by running a cash flow analysis or a financial plan. Right now, about 3/4 of Americans over 50 don't have a plan. If you can spend about 10 to 15 minutes with us, we can gather your data. We can put together a pretty comprehensive plan, and we can go in there and tweak that from there if you want to get more detail. But a lot of times we'll use this to look at even for somebody that's mid-career and making a change. We can go in there and say, okay, well, I'm leaving this company because I'm sick of it or because I got let go, and I want to find another job, but I want to find something that I like. I want to find something that is more beneficial to me. And we can go in there and back in the numbers and might find out, hey, you can work for 10, 20, 30 grand less than what you were making before, and maybe focus on a company that is a quality job versus maybe a quantity or versus the most you can earn. So, and we want to tie in the healthcare costs within that. So we're going to go through and look at those different options for you. Show you how long you can stay between jobs, or again, if you're retiring, show you how that healthcare cost runs through there and bridge that gap between retirement and Medicare in there as well. So it's good to explore all those different options through a cash flow analysis. So don't forget to just give us a call and take us up on that. Now, as far as Medicare, so once you turn 65, you're eligible for Medicare, and you have a kind of a 6-month window, 3 months before and 3 months after age 65 to go ahead and enroll in that. And there's going to be different options as far as what your premiums are going to be. In some cases, the base is going to be free to you. You may have higher costs than others if you've got higher income. There is a tier schedule there. Think about it like a Medicare tax, because it's tiered. And Medicare is supposed to guarantee roughly about 80% of what your expenses are. So there's alternate forms as far as how to supplement those potential expenses, which we'll get into in just a moment here. So kind of a refresher. So Medicare, your primary Medicare is going to be Part A, B, and D. So Part A is going to be covering your hospital. Part B is your normal doctor visits, routine, the outpatient things of that nature. Part D is going to be your prescription drugs. And then if you're looking at trying to figure out a way to cover the out-of-pocket expenses, again, we said Medicare is supposed to cover roughly 80%. So between co-pays, things like that, you might be on the hook for another 20% of it, or you might have some issues where there's a higher cost because you had some issues in a given year, some medical issues. And so really there's two things to look at. There's the Medigap option, or you can look at Medicare Part C. So Medigap is something where you're still utilizing Medicare, you're staying on Medicare, you're not making a change to that. It's just you're filling the gap, which again is why it's a gap insurance. It does still allow you to choose your own doctors. It's going to have higher premiums though than what Medicare Advantage will be, which again is Part C. Your average cost about $900 to $200 a month in this case. Again, some routine issues are not covered, like dental and vision and things like that and stuff. But you are covered anywhere in the United States. Your guaranteed coverage is not going to change or shift for you. Or you may say, hey, I want to simplify and just do a single Medicare Advantage or Part C. And what that does, that takes everything, kind of brings it together. And so what you're doing is you're going private insurance outside of Medicare, and they're covering the Medicare for you. So you're taking Part A, B, and D and kind of rolling it all together. And that C is that Advantage, which is covering all that, and it's going to reduce your costs. But again, you're paying for that as well. And so it's going to be more, think about it like an HMO. It's going to be some limitations as far as your doctor visits and the in-network versus out-of-network. It's going to lower your actual cost on a monthly basis, but it could have higher co-pays and stuff in there. So it's really important to kind of review these side by side and look at those options and check your doctors that you've been using for a while and see where they fall in these plans. And one may be more beneficial than the other for you. As far as I mentioned before, there's that potential tax, if you would. It's actually called the IRMA, which is going to be the income-related monthly adjustment amount, and that depends upon what your income is. So the higher income is, the more expensive your actual Medicare insurance is going to be on Part B and Part D. So for 2025, it's based upon $106,000 for somebody's individual and $212,000 for a married couple. Now, this is not your modified. This is not your adjusted gross income after deductions. This is your actual income that you're getting. So you could be, you might have $240,000 of income, but you got a $30,000 standard deduction brings you down to $210,000. But that's not going to help you in this IRMA related event. You're going to be in that second tier, which we'll show you in just a moment. And again, it's important to remember. So this is what they do is they look back 2 years. So they're going to look back 2 years to figure out what you're going to be. So let's say if right now you're 63, whatever your income is right now is going to be used for your Medicare cost premiums in 2 years in 2027. So it's important to understand that, and it's also one of the issues we see is that individuals they retire and they have a higher Medicare premium because of this. It's a little tough, but you can get that adjusted. So there is There is relief there if you go in there and tell them, hey, look, I'm retired. That's my previous income. This is the income that I'm looking at. So it can be done. So just keep that in mind. And then if we look at an example here, before we jump into what the IRMA brackets are going to be, let's take a look at Bob and Jane in this case. So Bob is on, is on Medicare now. Just turned 65. Jane's still 62, so she's still 3 years away from it. If you look at that right-hand side, because she's not Medicare eligible, she's on the healthcare exchange. She's on the silver plan in this case. It's costing her $1,200 a month for her insurance. But Bob, at least, it's a little bit cheaper now. It's costing about $312 because he's got the standard flat rate for Part B, $185, and he's actually gone in and got some supplemental insurance, Medigap policy for another $127. So if you didn't have that, it'd be even cheaper. But we had them right on that bubble at $212. So this is assuming they're at $212 and under. There's no IRMA issue for them, so it's costing them $1,500 across the board. Fast forward when Jane hits Medicare eligibility, you'll see her costs go down dramatically. So you can see that difference and what that bridge planning looks like. Now, if they made $212,001, then what's going to happen is they're going to jump. They're going to jump in that second bracket. This is for Bob, just for him. But if they were, let's say if they're both 65, then it would be double this. So we're looking at him going from 185 to 259 now, and was no Part D expense. Now it's going to be $1,370 per month. So I think combined that's about $87 more per month that he's paying on there. If it were two of them, it'd be what, about $170 or so more a month. And you can see how these brackets get higher and higher. Once you get up to 266, now you're at 370. If you get over 334, you're at 480, and it goes on and on. You might say, Wesley, this doesn't affect me. I'm retired. I'm making less than $200,000 easy as a married couple, and that's typically for most people. But another thing you got to be aware of is, as financial advisors, we're going to talk with you about that long-term aspect and planning, and a lot of times we may talk about Roth conversions as a great strategy to unwind some of your IRA money or 401k money and reduce your RMDs in the future. And not all advisors are created equal. You might have an advisor that talks about that but doesn't on the backside understand, hey, if we do a big conversion now, we're going to bump you up into the IRMA brackets, or they may think, hey, your adjusted gross income's under this, so we're good, but they forget that you don't get deductions in the IRMA bracket. So it's important to kind of review these. You may only make $150,000, but if you did a $100,000 wealth conversion, now you made $250,000 that year, and you're in that second bracket for the IRMA. So it's important to understand and review these side by side. So any question there, just let us know when we go through a wealth conversion. We definitely take this into account, and in some cases it may still make sense to pay it. Just think about it as an extra, I think about 1 to 2% tax in the scheme of things. Now, as far as premiums, and I alluded to it before, the rising cost across the board. So we look at 2025. The average cost for this a 40-year-old. So for a lot of people on this webinar, might be older in this case. We're focused on retirement planning, but either way, the average for 40-year-old in this case is about $627 a month on a I think it's silver plan in this case. That's about a 7% increase from what it was in 2024. And we look at some different states. Again, I mentioned the healthcare exchange. It's an exchange state by state, and keep in mind, some of these states are very limited. Some states might have 3, 4, 5 different choices as far as healthcare providers. Some, like Alaska, which is on this list, and some others, may only have one provider to choose from, or maybe county-based, and you may only have one choice. So really, you have no choice. So a lot of times you may see some increases there, and you have no control over it. But Vermont going up 27%, New York 19%, Alaska up 15%, North Dakota 14%. Utah up 13%. So again, across the board, we're seeing rises here, and it may be higher than what the national average is going to be. And then some additional things to look at, like I said, is each state has different providers. Some states have one, some have a multiple. If we look at that New York I mentioned before, look at United Healthcare here. 66% increase in costs going up in 2026. So obviously they've underpriced themselves, or they're pricing themselves out. You look at, I don't know who Elevance is, but you look at Colorado on all of these. The good news is Colorado has a lot of choices as far as providers, but it looks like they're all on the list. They're all going up in price. If you look down there at that very bottom, you may have saw the news in the last couple of months or so. CVS is getting out of the Affordable Care Act marketplace in about 17 different states. So that's affecting about 1 million members in this case. So again, it's really important. This is not going to tell you, what your specific situation is, but you need to look into your state if you are thinking about going on the ACA or the exchange for your medical insurance in this case. This is kind of redundant, but again, top 10 projected states for 2026 you're looking at. New York, Arkansas, Colorado, we saw them in there. Florida's got some bumps in there. Maine, Vermont, Maryland, all the way down to Texas. Again, that's Blue Cross Blue Shield going up 21% in Texas. So again, there may be alternative options that are not going up as much. And then as far as Medicare Part A, those expenses have been going up as well, not as much as some of these others we just rattled off. It's up 2.7% in 2025, which is lower than it's been the last couple of years. And this may be a moot point for you. I mean, you may not even need the medical aid. Hopefully, you're not going to the hospital or doing anything of that nature. So, which ironically, the thing that's going up the least is the one you may not necessarily use. So hopefully, the goal is we're going to try and get some of these things under control and slow down that growth across the board. So some strategies. We kind of talked about a lot of stuff as far as the cost rising. What can I do to mitigate that, or at least review that in this case for 2026? One thing is schedule your elective treatments before your deductibles reset. Maybe you had some treatment in the first part of the year and you've come close or hit your deductible. Get something else done if you need to before you have a new reset of deductibles next year. Stay in network versus using out of network facilities. In this case, it could save you quite a bit in some cases. Depending upon what you're doing on drugs, maybe switch to generic if there's something available for you now for that. Max out your HSAs if you want to build up some savings there to help cover some of the costs for insurance. Request cost estimates, and you can actually negotiate bills in some cases. So keep that in mind. Either you can have the insurance company negotiate on your behalf, or maybe you can negotiate them yourselves. And then I choose to plan strategically in 2026. Again, some of these potential rates are going up, so it may be, even if you haven't met your deductible, it may be worthwhile getting something done now before the end of the year, and then you can reassess maybe a reduction in plan options in 2026 to offset those costs. So with that, kind of wrap up and kind of bring back in the retirement group, give you a little bit of information about us and why it makes sense to give us a call to kind of work on some of these issues. And another note, we were the retirement group. We got acquired by Wealth Enhancement Group a little bit over a year ago. The great news for that is now we've got access to about 100 plus offices across America. We've got management over $100 billion under management, got more expertise than we had before. But again, a lot of our advisors still focus on working with some core companies. So if you've got questions on your specific company plan, not just these healthcare retiree medical benefits, but especially your 401k, how to allocate that, what to do with it post-retirement, how do I manage my pension if you have one, whether it makes sense to take a lump sum or do an annuity. We can go through all those different options with you. Again, we've got offices scattered across the country, so we can meet face-to-face. Obviously, it's easy to meet via phone or web meetings as well, if that's easier for you. And then we talked about that cash flow analysis and that financial plan. I'd recommend take us up on that. Even if you have done so previously, it's been 2 years or more, things have changed, interest rates have changed, the markets have changed, so it's good to update that and see where you stand. A lot of you may unfortunately be going through a reduction. So if you want to see, even if you think, hey, I'm safe, I'm not going to get cut. Unfortunately, I've seen a lot of these companies, they make illogical decisions. I've seen people that want to go, not get tapped on the shoulder, and people that think that that there's no way they're going, get cut. So if you just want to see where you stand in case something were to happen, let me know. We can run a cash flow analysis for you and show you those different options so you are prepared and not blindsided by something. And then as far as the next steps, just give us a call. We'll be happy to schedule an appointment with you. You can reach that 800-900-5867. There's also an email, info@theretirementgroup.com. We'll have a couple QR codes up here while I get into some of these questions that came through. So one is going to get into scheduling an appointment with myself or one of the other advisors with the Retirement Group and Wealth Enhancement Group. One's going to be into our LinkedIn page if you want to follow along there, and if you want to get in more detail on company-specific information, you can do that as well. Okay, so first question I have in here, what if I start the Affordable Care Act and get a job later in the year? So this is actually it's a good question. It's something that's great if you're able to get that job, but a lot of people are not aware of kind of that process. So I'm going to make up. Let's say you leave the firm. Let's say you leave the firm in September. Okay, and so you don't do COBRA. You decide to jump on the healthcare exchange in October. So you've got you're on the exchange in whatever state you are for October, November, December. Say January, February, March, April. So 4 months in 2026, and then all of a sudden you get a new job. And so what happens is, depending upon what that job is, it may affect that healthcare exchange that you have. If they allow insurance, you may have to go off of it and may have to go onto the company's plan. If you decide to stay on the Affordable Care Act, but now you've got higher income, they're going to come back and adjust that, and you're going to have to actually pay, I don't want to call it a penalty, but you pay back the subsidies that they're giving you. So it's not going to be as cheap as what it was the first part of the year or the last year. So it's important to kind of understand that and see those options through. So again, any deeper questions, just give us a call. And then one more I'll take the time to get to. Any that we missed, just we'll follow up with you on them. But can I change from Medigap to Medicare Advantage? Okay, yes, no, maybe so. I guess is kind of the answer to this. So you can change, but again, it's based upon open enrollment usually. So you have to do this during open enrollment. You can't do it outside unless there's a life event or a life change. So again, a lot of times once you retire, there may not be much of a life change with the exception of making a move. So if you move, let's say in May, then you could make that change potentially. But for the most part, it's going to be during open enrollment, again, October 15th through December 7th. So at that point, yes, you can change. So you may be, let's say, you're on the Medigap, and you say, okay, well, maybe I found out, the doctors I'm using are all on the same, plan through Medicare Advantage, and it's going to cost me a little bit less, and I just want to kind of simplify it. Then you can do that. You would actually, you can go from Medigap, you'd have to disenroll in that, and then you would move over to Medicare Advantage. On the flip side, for your Medicare Advantage, and you say, hey, this is not working out. I don't have access to the doctors I wanted to. I want to be on Medicare and Medigap. It could be that you got a condition that may hinder you from staying on Medicare Advantage in the future because they don't have that guarantee insurability. So you may say, hey, I need to get over to Medicare and get on Medigap. You can do that again. You have to unenroll from one before you can enroll in the other. So it is a process, but yes, it can be done. Again, any question on there, just give us a call. So with that, I'm going to kind of wrap this up. I want to thank everybody for joining us today. There's obviously a lot of details that go into that healthcare planning. Just give us a call at 800-900-5867. We can kind of dig into some of those items, but really kind of put it to pen and paper and show you that financial plan and help you see how not just this affects you in retirement, but how your entire portfolio is going to affect you and tie everything together for you. So with that, I want to thank everybody for taking some time out of their day, and we hope you have a great rest of the day.